Hello everyone, my name is Sam, I'm a GP. Today I'm going to present on a topic called causes of headache. Headache is a very common presentation to general practice, so it is very important that we have a list of common and uncommon causes in mind when we see patients presenting with headache. As usual, before I begin, I'd like to take this opportunity to revise the principles of good history taking. 1. Know your general anatomy. 2. Identify the underlying structure and/or organ at the location of the presenting symptom. 3. Identify the surrounding and/or related organs. 4. Think about the different pathological processes that can affect the organ. The mnemonic that I use is IntoMed DDDD. And 5. To be able to use key history features to identify the most likely cause of the presenting complaint. So again, here is what IntoMed DDDD stand for. So this is a table of common and uncommon causes of headache. The first row shows common causes, and the first column shows common infective causes. These include respiratory tract infection, sinusitis, and dental infection. Next, we have got traumatic cause. Traumatic cause include post-traumatic headache or post-concussion headache, which is very common and only require supportive treatment, massage, and physio in the absence of red flag symptoms. Next, we have got obstructive or compressive causes. Commonly, these include cervical spondylosis or dysfunction, which essentially refers to the degenerative process of the cervical spine, causing inflammation, therefore obstruction or compression of the nerve coming out from the cervical spine. Stress-related headaches such as tension type headache, migraine, or exertional headache are also very common in general practice. And finally, refractory eye problem such as short-sightedness or long-sightedness all can cause headache associated with difficulty in vision. Cluster headache is also very common. It is a type of headache that presented with headache associated with watery eyes, photophobia. The treatment is 100% oxygen. In older people, we have to think about other causes. These include inflammatory causes such as temporal arthritis, which is inflammation of the temporal artery on either side of the temple. Glaucoma, which is increase in pressure within the eyeball, can also cause headache. Low blood sugar can also present with headache associated with dizziness. The last row demonstrates rarer but potentially more serious causes. The first column shows infective cause. These include infection or inflammation of the lining of the brain known as meningitis, or infection of the brain itself known as encephalitis. Formation of pus in the brain known as intracranial abscess also present with headache. Pre-eruption of shingles affecting the cranial nerve number 1 known as ophthalmic herpes zoster can also present with headache. Because these are infective causes, they also present with temperature as well. Next, we have got neoplastic cause. So any tumor within the brain, such as a cerebral tumor or pituitary tumor, all can present with headache. Traumatic process such as bleeding, including subarachnoid bleeding, intracranial hemorrhage, dissection of the carotid or vertebral artery, hematoma, either extradural or subdural, all can present with headache. Obstructive process such as clot formation within the venous system of the brain, known as cerebral venous thrombosis, commonly present with headache. And in a condition called benign intracranial hypertension, there is an increase in the pressure of the cerebral spinal fluid within the cranial cavity, causing extra pressure on the brain, therefore headache. And finally, post-surgical procedures such as epidural or lumbar puncture can result in the disturbance of pressure within the cerebrospinal fluid space, therefore causing headache due to changes in pressure within the brain itself. Thank you for taking the time to watch my YouTube video. If you like my presentation and my structure of presentation, please kindly subscribe. Thank you. And this is my disclaimer. Have a nice day.